All right, welcome. So nice to have you here on a beautiful summer evening. And I'd like to welcome you to our first session of our summer webinar series on healthcare transition and some very important topics for youth parents and providers. I'm Diana Rovetti, and I work at the Nevada Center for Excellence in Disabilities. And we're doing this summer webinar series to help families and providers to learn more about healthcare transition and also some very important topics that are need to know for children and youth with special healthcare needs. My projects focus on health and physical fitness for youth and adults with developmental disabilities. And this week I'm running a bicycle camp to teach kids and adults with disabilities how to ride a two-wheeler, and that's going really well, super exciting. And so tonight we're starting this first webinar series, and I would like to introduce you guys to my cohort on this grant, Mr. Travis Mills.
Hi, everyone. Thank you all for coming today. My name is Travis Mills, and I'm a video photographer at the Nevada Center for Excellence in Disabilities. So I do the I Can't Bike program where I help people with disabilities learn how to ride bicycles. And we also do the Tennis Buddies through Reno, and we teach people with disabilities learn how to play tennis. We also do many programs. We have the assistive technology throughout the NSAID, and we also do the Family Navigation Network and Path to Independence, where we teach people with disabilities to learn how to go to college. So it's really cool.
Thank you, Travis. Tonight, we have some very special guests with us, and I'm going to be introducing them to you in just a couple minutes. But I would like to start off with a 2-minute video on healthcare transition and why it should be important to you and me. And so tonight I would like to introduce our guest speakers, Ms. Estefania Caldera and Aleksa Owen. We're very pleased to have them from one of the projects here in the NSAID. It's, I believe, our newest project, and it's called the Family Navigation Network, and they're here to tell us all about it. And also they'll be including information on the Nevada Medical Home Portal. So without further ado, I would like to turn the time over to Lex.
Hey, thank you so much. This is Lex. While we're getting that going, you'll hear a little bit more from Estefania and I in just a minute, but first just wanted to kind of, as Diana said, we're gonna mainly talk about the medical home portal and then also share a little bit about the Family Navigation Network, hopefully as an entity that can help support you if you're a family member or a person with a disability, or if you're a professional. We also work with professionals to better support families. And we really believe in the idea of family professional partnerships. And so that's a key part of what we do. I know that, so what we're going to talk about tonight is really a resource, the medical home portal, which sounds like a real mouthful, but we're kind of break it down in terms of what a medical home is, what the medical home portal is, and then what it does for families. So we're going to highlight a few key resources that we think are really not to be missed. We'll also then kind of talk a little bit about the Family Navigation Network. As Diana said, this is a project of the Nevada Center for Excellence in Disabilities. We also want to know what would help you all. So at the end, we really want this to be a conversation to kind of further understand what is going on for you all. What's a barrier? What's helping you get what you need? We really want to hear from you all. So be thinking about that in terms of what else, what didn't we talk about tonight that you are really curious about? That will help us inform our future programs and services, as well as the work that Diana is continuing through this series. We also wanted to just say a quick word about our funding attribution. So we are funded through the Nevada Department of Human Services, Division of Public and Behavioral Health. And then also we're funded by, at the federal level, the Health Resources and Services Administration. And so I know we have some maternal, child, and adolescent health team members here tonight. So we appreciate you being here, and for making this work possible. And the next kind of step here is we want to do introductions. So I think we have, do we want to do, let's stick with folks introducing yourself in the chat. And then while you're doing that, Estefania and I will introduce ourselves. And I do want to say the image on the screen here is an image of our, a few of our staff members, as well as several of our interns. And so one of our interns is here with us tonight, co-presenting, that's Estefania. So Estefania, I'll turn it over to you to introduce yourself.
Hi everyone, I'm Estefania Caldera. I was the Bachelor Social Work intern for Family Navigation Network last year, and now I'm a member. And in the fall, I'm going to be entering my master's for my social work, and I'm very excited to be here tonight.
And like I said before, I'm Lex Owen. I work at UNR both in the capacity of being an assistant professor in the School of Social Work, and I also co-direct the Family Navigation Network within the Nevada Center for Excellence in Disabilities. So we're really excited to be here tonight with you all. And again, like I said, please do introduce yourself in the chat. Let us know your name, where you live, and again, if you have questions that are coming up right now, feel free to pose them there or jump in there at any time.
So first, we're going to go over what a medical home is. It's a way to describe a patient-centered care, and the care approach is team-based, coordinated, comprehensive, quality and safety focused, and accessible. So this is a website that anyone can use, and it's basically a center where you can go and find anything that has to do with health navigation. So the Medical Home Portal is a web-based resource that offers Nevada-specific information about children and youth with special healthcare needs. It includes tools and info for providers and families, and has specific diagnosis information. In this Medical Home Portal, the website is also known as a one-stop shop. And what that means is when you go to this website, there's a little bit of everything and a variety of a lot of things that you can find information on. And the modules that are included are diagnosis and conditions, newborn disorders, there's resources for families and parents, for physicians and professionals, and another thing that is provided is a Nevada Service Directory.
Might be a new resource to you. It is actually funded by the Nevada, the Division of Public and Behavioral Health. And so we want to kind of make sure that it's going to be as useful for you as possible. And there is so much in this resource. So we kind of wanted to break some of those things down and really focus on some things. So Estefania is going to go over a few of those.
So for the diagnosis module, the diagnosis and condition module, it provides information and tools for families and clinicians whenever you are curious about a diagnosis or you want to get more informed in a diagnosis. This is a module you would go to. As you can see, there's a lot of things provided by this tab. There's a description of a condition, the treatment and management, resources for families on the diagnosis, clinical assessment, resources for clinicians, and services for parents and families. And then on the next slide, this is how it looks on the website itself. And like I said, there's a bunch of tabs within this module that you can go into and look for different resources. For example, there's screenings and treatment and stuff like that. And each diagnosis comes with this variety of information. And then another part of this website is the resources for parents and families. And as you can see, also this has a lot of information within the tab as well. One of the most important things would be legal issues, diagnosis and conditions, information on education and schools and stuff like that. It varies, but all of these tabs have information below them as well.
So thinking about a few of the kind of key resources that really we want to highlight here to ensure that they're not to be missed. The first is the Care Notebook. The second one is apps for mental health, which I think we know that nationwide and in Nevada, among children, youth, and adults, we have some big mental health issues, right? The families that we work with, over 40% of those families report unmet behavioral health needs and mental health needs. And so we know that this is a really big issue for families and individuals. So we think however we can get access to those mental health supports, we want to make sure that we're highlighting those. And then we'll also talk a little bit about some of the social opportunities. That's another need that a lot of our families that we work with report needing, specifically for children and youth with autism, or other similar diagnoses, finding those social opportunities are a key things there. So thinking about the care notebook, this is what it looks like. There's on the right side of the screen, there's an image that just says care notebook. And the other thing we wanted to say is that this is available both English and Spanish. And so I'm actually going to pull up the PDF of the care notebook itself. I'm going to scroll a little bit, so excuse the scrolling, but I wanted to for you all to kind of see exactly what this looks like. And so there is a lot here. I'm not going to go over everything, obviously, because you can look at this yourself and see what needs this may meet for you all. So one of the things, if we go back to that idea of what is a medical home in the first place, right? It's really an approach to care that's patient-centered. And this idea is that instead of the care being or the decisions or the information being stored with a specific provider or a specific specialist or a specific insurance company, right? Rather that it really is centered on the person, on the patient themselves, right? And so we also know that especially for families of children, youth with special healthcare needs, there is often a lot going on. There might be multiple specialists, multiple prescriptions, and multiple needs that that patient is bringing with them into each clinical visit, or even in accessing different support services, right? That might be related to healthcare in some way. So it makes sense. And I think a lot of families have had to kind of learn this the hard way a little bit. I think I find when talking to families that they are really the expert on their child's care and their own care. But this is hopefully an easy way if you are just getting into this, or if you want to make sure, if you want to have a document or something to be able to give new providers, or maybe it's in case of emergencies, right? To be able to have this information all in one place. So this is kind of all of the different components of the care notebook. And so we wanted to, and then later on, you can see down here, there are fillable, so you could print this out and you could handwrite it, or you could, if you have access to a certain kind of program, you could fill it in online if that's doable. And so this is something that if you are a provider, you could give this to families, right? You could print some of these out or send them the link and make this available to families that you work with. So there might be, instances where only one of these sections would really be needed, but maybe, maybe it's just one section that you end up using, but there are there's a lot of potential to be able to use this tool. The other thing I like about this is that it's very person-centered, right? So we know that person-centered kind of human services practice and person-centered planning are, huge things that we want to make sure that all of our services and supports for people with disabilities and people with special healthcare needs are taken into consideration. And this care notebook really does that. It really puts the person at the center of their own care. We hope also that this turns into, we know that patients who have access to their own medical records and to their own health information end up having higher satisfaction with healthcare, and they end up feeling more empowered to make those healthcare decisions in conjunction with providers. And so those are the kinds of things that we think a tool like this can really help. We also wanted to point out that there are some apps that are, obviously these are not available exclusively through the medical home portal, but they are kind of a nice centralized location where these apps have been collected by folks who have developed the medical home portal. We know, again, like I said, that there are a lot of folks who are experiencing, mental health issues, whether it be depression, anxiety. And we also know, this is kind of across the board, but we also know that youth and young adults with developmental disabilities experience mental health distress at a much higher rate than their peers without developmental disabilities. So we know for this population specifically, it's even more of an urgent issue. And so while we are also working on making sure that young adults, youth, children with disabilities have access to professional mental health treatment. We also want to think about how we can support families, right? We want to use every single kind of capability at our fingertips to be able to support families in this way. And so I think the medical home portal does a really nice job of anticipating those needs and really providing. And then these are those social opportunities we talked about. So they have nicely developed a table. This is the image on the screen is a table that kind of breaks down the different providers related to social opportunities, different kinds of social opportunities that are available in Nevada. If you wanted to, when you were in the medical home portal, you could click on each of these numbers and it would link you directly to a list of all of those different providers. So, this again can be a great place if whether you're a family member yourself or you're a professional to be able to send families in these directions.
So on this slide, as we said, the medical home portal offers a lot of resources, and sometimes it can be tricky to find a specific thing that you had seen before or that you heard about us talking about. So when you find the sitemap within the medical home portal, it lists out every single tab there is to the website. So if you are having trouble like finding it through different tabs and stuff like that, the sitemap offers a list where you can read out everything that there is available to you, and hopefully it's easier to find the information that you're looking for. And another service that is really amazing through the Nevada Medical Home Portal is the Nevada Service Directory. And this is basically where you can find services within the state that offer support for your child with special healthcare need. And you can look for anything from therapies to social opportunities to where to take your child for like care and stuff like that. So you can look for that in the Nevada Service Directory. And this is how it looks on the website. You can look up the term or a service category or location within this tab. And it pops up with a map that shows every single service that is included within your service category, as well as the organization name, address, phone number, the website, the services provided, and where they got the information from. So whenever you are looking for a service, this is a good way to start and see what is available closest to you.
Is generated by Nevada 211. So, in a lot of ways it's been vetted. And also, if you notice that Nevada 211, we've been working with them and they are really responsive in terms of making sure that they have the most up-to-date resources. We know that in the last couple of years, some places have unfortunately closed, other places have opened, right? So we know that there are those things are changing sometimes, and they are really doing their best to keep on top of that. And they are very, very much open to feedback from community members, from professionals, and from families. So Matt Montgomery, I think that answers your question. So it does go through Nevada 211. So checking with them would be the best thing. And I am happy I know at one point they were seeking input about resources. And I know that is also, I have a feeling that that's kind of ongoing, that process. So the other question, I think Megan Marble, you were asking about how do we get on this list? So this is all of these kind of slides are screenshots that we're showing you from a website, and then Estefania put a link to the sitemap. So these are all available online on this website called the Medical Home Portal. And I also want to say that if your internet access is unstable or you don't always have access to internet, we at the Family Navigation Network would be happy to print any information out for you and send it and mail it to you. No problem. We definitely, we know that, in Nevada, there are, some rural areas where there may not be reliable internet access. We want to make sure that everyone has access to these materials. So if you know of a family or you yourself have a need for that, please feel free to reach out to us. We'll make sure to also put our information from the Family Navigation Network in the chat. Yes, and then Diana, you put the link to Nevada 211 in there, which is terrific. So just wanted to say that.
Yeah, I recently wanted to add something to there, and they are very, very responsive. And in fact, I sent an email, they sent me an email back, and then they called me because they hadn't heard from me in like 2 days. So they want your information. So go ahead and go on there, and you could just do it. You could submit that online.
they're really responsive. They really want to make this as useful to folks as possible, and they're pulling from, you know, a really broad list, and so you know, we want to make sure that that information is out there. Yeah. And then kind of switching gears a little bit, we wanted to also just talk a little bit about the Family Navigation Network itself. As we said before, this is a project of the Nevada Center for Excellence in Disabilities. And I'll talk a little bit about kind of what we do. Mostly is one-on-one support. We provide information, referrals, and also quite a bit of peer-based support as well. Most of our staff are either family members of people with disabilities or people with disabilities themselves. So there's a real sense of kind of understanding the mazes that, you know, many families experience in trying to access healthcare and related services and supports. We know what it's like to be on the phone with an insurance company for a day, right? We know what it's like to spend time going from clinic to clinic, or to be frustrated because you drive to UC Davis and all of a sudden they're telling you they don't take your insurance anymore, which I have had families tell me has happened to them, right? So we understand that there are issues in terms of accessing healthcare, and there are issues in terms of that, making sure that families are satisfied and feel kind of that they have a choice, right? That they have a say in the healthcare that they or their child or youth is receiving. The other thing that we really focus on is help with application. So this might be something like Medicaid. We also help with Katie Beckett Medicaid, which is a program that is designed for children and youth who have kind of complex medical needs and meet a certain level of kind of disability, kind of impairment and functioning. And essentially what it does is allow those families to receive Medicaid without having an income cap put on that eligibility. Many families say, well, I make too much money to be on Medicaid, but if you're able to get accepted to the Katie Beckett program, if you're eligible for that, you can actually receive Medicaid for that individual that needs those extra services, and often have quite a bit of higher healthcare costs. So that's really what that program is designed for. And we really want to get the word out about that program, that it exists, and then also make sure that we're supporting families who are trying to apply for this program. This program is it also is complicated to apply for. There's a few different state agencies involved, but we and folks who work at the Katie Beckett program really want to support you in that. So if you even think that you might be eligible or interested in pursuing this, please let us know, reach out to us. We're happy to work with you on that. Or there might be instances that, you know, all of a sudden, for some reason, you know, someone has never been eligible for Medicaid before, but all of a sudden you are. So we want to make sure that you're able to access that, so that, again, we can ensure that families are able to get the healthcare that they need and feel good about the healthcare that they're getting. Like I said before, we also educate professionals about what families are experiencing and what families need. Many professionals, you know, hear these stories, right? And you may say, I wish I knew, right, the answers to those things. So we really want to support you all in that, right? Whether you are a clinician, an educator, we want to kind of work across and within systems to help to support families to fill some of those gaps that we know are happening. And kind of the last bullet point, you know, I've kind of gone over this, but, you know, again, just emphasizing that we want to overall see families of children and youth with special healthcare needs doing better, right? We want them to be able to access healthcare that they need, and we want them to have a good quality of life, right? We also want to increase that, again, that satisfaction, right? That kind of goes along with getting your healthcare needs met. That's really, at the end of the day, our goal. So I put a few ways to contact us. On the right side of the screen, you'll see a QR code. So if you want to use your smartphone, go right ahead. That'll take you right to our website. We also have a toll-free hotline. It's 833-427-1673. And then we also have an online intake form on our website. And then finally, you are welcome to email us at nzfamilynab@unr.edu. And first, Megan, you asked, do you provide support for families navigating the IEP process? So the answer is generally no, because we are really healthcare focused and we work closely with Nevada PEP, who is a statewide organization, and they support, they're kind of more education focused. So they are kind of the entity that is designated with supporting IEP meetings. We know that is a need. We definitely hear that. So if you have that need, we can help put you in touch with Nevada PEP, regardless of where you are in the state, and we can help you find, the right person to support you in that. We also have some resources related to that. So we work closely with Nevada PEP in terms of kind of referring back and forth, right? So those are, again, we kind of want to strengthen the ability of families to really advocate for themselves and their families. And then Claudia Amaya asked, are the services available to families who are undocumented? For sure, yes. We do not ask about immigration status. And we have worked with folks in the past who are undocumented or who have differing immigration statuses within families. So that's something that we are familiar with, and would obviously be glad to work with families in those situations for sure. And then Diana said, oh yeah, that's right, thank you. Yes, so Diana, so the folks who run the Katie Beckett program, who are amazing, they will be coming later in the summer on one of these webinars, and they can definitely go more into detail. And then in the meantime, if you have questions before that, please feel free to reach out to us or to them. So I just wanted to highlight again, kind of the broadness of what we're doing, right? So a lot of the families that we work with do have families, children or youth with disabilities. But if we think about what a special healthcare need is, it's really anyone who is spending a lot of time and a lot of money trying to access healthcare, right? That is kind of how we got to this designation. And we know that in Nevada, over 15% of children and youth have special healthcare needs. So this is a significant part of our state's population, and over 1/5 of households have at least one child with any kind of special needs. So we know that this is an issue, that these accessing healthcare for these children and youth is a big issue, right? That doesn't impact just a small number of folks, but actually a large number of folks. And I think one of the things that we also want to do is make sure that we're thinking about how to reach families and connect families with resources that may not be a part of these systems yet, right? Who may not even know that they qualify for certain things or that they are kind of welcome into this community at all. The other things that we wanted to just mention is that there is something called the Public Health Emergency Wind Down. And so this is, that's a very long way of saying that everyone in the country, all state Medicaid programs are going through redeterminations for Medicaid. So if you have any kind of Medicaid, I know there are several kinds of Medicaid, of course, in Nevada. These are just some things to think about over the next year. Everyone will have to complete a redetermination process to kind of re-up that eligibility. That's a part of this changing over from what was called, there were like certain regulations that were waived or not used during the pandemic. So we just wanted to highlight a few things and kind of just put this on your radar if it applies to you. The first thing that folks at the federal level have asked us to share with you all is that we want to make sure that your contact information is updated, so that in this case the Division of Healthcare Financing can reach you, the folks who run Nevada Medicaid, and also the idea of just checking your mail, being on the lookout for any letters or documentation from these entities, and then actually completing those renewal forms if you get one. Just wanted to kind of put that on everybody's radar. And if you work with families or you know other families who might be in this position, who use Medicaid at all, please do share this information with them. And finally, many folks have a lot of things going on, and a lot of may feel like you have a lot of needs, but we really want to know what's helping you get needed healthcare for you and your family. What's working for you all? What would you want to see more of? What's going well? And then, on the kind of flip side, what is keeping you from getting needed healthcare? What do you need more of? What do you need less of?
Ali sets up in the chat, said care coordination for children with complex medical needs would be
phenomenal.
Care coordination for children with complex medical needs is a huge issue, right? We know that right now. Most folks have to go out of state. They end up having to go out of state because we don't have, the capacity to meet those needs. I'll just read out Megan's statement too. As a provider, the credentialing process really sets us back in terms of being able to see clients in a timely manner. Yeah, so again, there's lots of other kind of workforce development, right, issues as well that might go into the ability of us to have providers to meet our needs. Yeah. And then Claudia Amaya says, several of our families aren't aware that when their children with special needs turn 18, they need to apply for guardianship. Yeah, that's right. So there has to be a transition. And I also want to take this opportunity to say that in some cases, guardianship may not be the best fit, right? But rather setting up supported decision-making agreements might also be an option. But that the idea of transition itself, transitioning not just healthcare, but in general, right? There's a lot of need for families to kind of pay attention to that, and lots of opportunities for providers to support families in that. Jay says, it seems ABA, which is applied behavioral analysis, is always recommended for autism, but we haven't seen gains. So I'm looking for alternatives, right? So other things, so other kinds of therapeutic opportunities for an autism diagnosis would definitely be something that you would be looking for sure. Matt Montgomery says the lack of doctors in our areas. Yep, we know that is definitely an issue. Laura Jenkins says, who can we discuss supportive agreements with? And I'm gonna honestly turn this over, let Travis and Diana talk about this, because they actually were a part of enacting legislation related to supported decision making. So maybe you both could talk a little bit about that.
So the courts in Nevada and across the country really are doing less guardianships these days, and really trying to have more, give people more control in their lives, because as you know, guardianship strips all of your rights away. And so more and more people are looking to support decision-making agreements. And we started a website here in Nevada. Travis was one of the key, you did a testimony at the legislature to pass the support decision-making law.
Yep.
In back in 2019. And on August 10th, we're going to be having a talk on supported decision-making on our webinar, but also we have a website, and Travis, if you could put that in the chat box, the Nevada Supported Decision-Making website, which gives you lots of resources on supported decision-making. But I also wanted to tell Laura, if you would like to talk to somebody, and since your daughter is going to be over 18, she can receive services from Nevada Legal Services, and they're doing a lot of work around supported decision-making.
To follow up on, Jay says, to follow up on doctors, it'd be great if they were covered by insurance, the match doctors. Yes, yeah, so making sure we have that insurance coverage for sure. Yep. So a lot of common themes here that are coming up for sure. Know how to better support families in terms of making sure that we're on top of resources that rise. Sometimes new things come up, and all of a sudden we realize there's kind of a trend, right? A lot of families are experiencing similar things. So we want to be able to respond to those things. We also, sometimes do trainings like this, similar to this. So we want to make sure that we're able to do those in a way that we're prepared and really is meeting folks' needs. That mostly I just wanted to say thank you. And again, we see our funding attribution down here at the bottom. And I did want to just shout out that we have the Children and Youth with Special Healthcare Needs State Coordinator on the call here. Cassius Adams is newer, not really that new anymore in the role, but Cassius, maybe if you just want to say a few words and tell folks a little bit about your role and kind of how you work to kind of a little bit behind the scenes, but really to support families, if you want.
Thank you very much, Lex. So, hey, nice to meet you, everyone. I actually do happen to work with Medical Home Portal quite a bit. So yes, just to reiterate what I was saying, when you navigate to that site, you're going to find an area to search for providers. And if the person you're looking for is not there, there's a little link that you can click on that says recommended provider. And that's also how we can get information. We do actually get the bulk of it from Nevada 211, as Lex is saying. So it can come to us that way. But families, other providers who simply know someone who would be contributory, go ahead and do that as well. And so what we're really trying to do with the portal is just make it that one-stop shop, as Lex and Estefania were saying, for everyone and their needs. So yeah, there's actually a link to FNN on the MHP site. So I'm happy to see this cooperation. We're looking to grow it. There are only a couple of states participating right now with Medical Home Portal, but they're in an evolutionary stage. So they're looking to grow, to find more partners. I know Arizona is looking to join the MHP, and we're going to make it even better than it is now. So thank you, Lex, for providing me with an opportunity to speak. And this was a wonderful talk. So thank you.
Yeah, so great to work with you so far. And I know that you are really, working to represent Nevada well within the MHP folks and within the folks that are working behind the scenes to make this the best resource that we can be. And again, I guess the last thing I just want to say is that, the idea of a medical home, it's really something that that we can advocate together for, right, with providers. We know that many providers are already enacting this model of healthcare, this idea of patient-centered care. This is really becoming standardized in practice. And the American Academy of Pediatrics has said that they believe that every child and youth should have access to a medical home. And so, I think I kind of take that as part of our mandate, right? Part of our work and really this value that we should work towards building a state where that can happen, right? At this point, we know that children and youth, specifically with special healthcare needs, have a slightly lower likelihood to have access to a medical home than nationwide. So we want to make sure that we're, providing opportunities for families to be able to have those conversations with providers, right? To bring up and say, hey, do I is this patient-centered, to really have that in our minds. It's not always easy to have those conversations, but we want to make sure that that we're supporting families to be able to do that, and that we're able to support professionals, right, in making that happen and making it easier and more streamlined for them to work with families as well. Well, I really appreciate you all. I've really enjoyed the time that we've gotten to spend together tonight.